will actually improve quality of life, increase longevity, and decrease the burden on the healthcare system. If you're a doctor considering a non-clinical career that leverages your medical and clinical experience while making a positive impact on people's lives, this video is for you. In this video, I'll talk about why I think doctors should pursue a career in public health, courses and skills that I think that you will need to prepare you for a career in public health, and opportunities that are available in public health. First, let's start with why doctors should pursue a career in public health. Our healthcare system spends more money on treating disease rather than preventing disease. And this is a huge problem because a lot of disease and illnesses can be prevented. And it's a personal mission of mine to change how we view and promote healthy behaviors. Public health focuses on improving the health of the population. Doctors provide direct patient care through clinical screening, diagnosis, and treatment after a person becomes sick or injured. Public health professionals make policy recommendations, develop and implement educational programs, conduct research, coordinate health services, and develop messaging campaigns and programs to prevent disease and illness. As a doctor, you're already qualified to provide this kind of medical advice and guidance, and are the best people to educate the public because you already have this education. Public health would be good for doctors who are interested in looking at the bigger picture of health and making a positive impact on people's lives at scale. Public health is very broad and there's a lot that you can do with it. A great way to figure out whether it's a good fit for you and what type of public health career you would like to pursue is to take a course in public health. I completed a master's in public health and I'd highly recommend it. There are some skills that are very valuable to pursuing a career in public health, and I think that many doctors have already developed these skills. Some of these include leadership skills, good communication, the ability to work under pressure, research experience, having empathy, cultural awareness, and an understanding of local laws and guidelines. For doctors wanting to pursue a career in public health, a master's in public health would be very valuable. You can do it part-time while you're practicing clinically or trying to figure things out. When looking into an MPH course, I would look into accredited courses and try to talk to a few different people who have taken those courses before you and see whether or not they liked it, whether or not it was organized and well run, and what their experience was like. You can get a lot out of interviewing a few people about the course itself. Remember, not all courses are created equal and they don't all have the same reputation, which can affect your job opportunities after completing the course. It's important to do your due diligence here and do your research into the courses that you want to apply for. And once you start your master's in public health, also consider the classes that you take. There's a lot of subspecialties within public health, such as epidemiology, biostatistics, community health, behavioral health, nutritional public health, international public health, health economics, public policy, and the list goes on. It's a broad specialty, so there's something for everyone. Research whether or not they offer classes that you'd be interested in taking. I was very interested in nutritional medicine, so I took a lot of nutritional classes. I'm a huge advocate for understanding what is in foods, the vitamins, minerals, and nutrients in foods that affect our health and can boost our immune systems. I use the things that I've learned in these classes in my life today. A lot of what I do, a lot of what I practice, and a lot of what I advise is because of what I've learned in public health, not in medicine, in terms of food, nutrition. It's good to note that if you can't take an in-person master's in public health, you can actually do it online. Harvard T.H. Chan School of Public Health offers an online MPH course, and I've heard good things about it. So this is something that you can consider. I'm sure that they have a great network of people that can help support you through the course and can provide you with opportunities after you complete the course. People have asked me whether having a master's in public health is worth it or not. And I definitely think it is worth it. It equips doctors with skills to address health and wellness on both an individual and population level. There's more of a focus on preventive and lifestyle medicine, which is what I'm passionate about. And I think a lot of doctors who went into medicine are too, but they just did not get to study this or practice it when they became a doctor. And you get to zoom out more and look at the bigger picture of healthcare, and our system as a whole. I think is really fascinating to look at all the components and determinants of health. On top of taking courses, I definitely recommend applying for internships and fellowships in public health, where you can get training in health policy and support investigators who want to participate in public health research. This is a great avenue to get your foot in the door in public health because it can lead to a lot of job opportunities post-internship or post-fellowship, and provide you with the right networks. So now that we know what is needed to prepare for a career in public health, what are the career opportunities in public health? I'll start with opportunities globally. One great example is the World Health Organization. The World Health Organization directs international health for the United Nations in responding to global health issues such as the pandemic. Another way to get involved internationally is to work with organizations focused on helping and supporting developing countries to help educate and prevent disease and illnesses that are prevalent within those specific communities. You can also find public health career opportunities within your own countries. For example, in the United States, the federal government is one of the largest administrators and purchasers of healthcare service. They play a significant role in managing population health through health policy and financing and delivering healthcare services. For example, the CDC conducts research, issues policy and behavior recommendations, distributes funding and monitors disease incidents, and implements programs to prevent disease and promote healthy behaviors for the whole country and globally. Can't have a bigger impact than that. You can also look for public health opportunities in your state and local governments. They will post job listings for public health professionals to lead on community-based prevention programs and also work in health centers where you can shape policies and implement programs in your local communities. Your local health departments conduct the community health assessments, develops emergency response plans, and health promoting policies. There is also the opportunity to work in academia and research in public health. And this is something that I did. I remember specifically doing a research project on lead and how it affects children's development and the effectiveness of lead reduction intervention strategies, one being calcium supplementation in pregnancy. And this type of research helps develop guidelines to promote healthy behaviors that will prevent disease and illness in the future. And lastly, there's also the opportunity to work at NGOs, non-governmental organizations, such as the Red Cross and UNICEF are the more well-known ones, but there are so many globally and locally. You just need to do a bit of research, look into things that you're passionate about in public health, and I'm sure there's an NGO that you can work for. These kinds of things will make a bigger impact on people's health and well-being overall, and I'd love for us as a community, as healthcare professionals, to drive that and lead the future of medicine and healthcare to start focusing more on prevention rather than treatment. And I think we will be better off for it. So there you have it. I talk about why I think doctors should pursue a career in public health, courses and skills that I think would help prepare you for a career in public health, and all of the different opportunities there are in public health. And trust me, there are so many. I think a lot of doctors that reach out to me feel limited in their prospects for work because they only have a medical degree and only have experience in medicine. But your medical degree, your experience, all the soft and hard skills that you have translate into a lot of different industries. So don't undermine that. We need to change the way healthcare is done, and I believe that we will actually improve quality of life, increase longevity, and decrease the burden on the healthcare system by focusing more on prevention rather than treatment. Thank you so much for watching, everyone. I hope this video was helpful. If you have any questions, please feel free to reach out to me or comment in the comment section below. If you want more content like this where I talk about different career opportunities for doctors to pivot, please like and subscribe. Hope you're all doing well, and I look forward to seeing you in the next video.